Yeah, I am one of those rare breeds called a GP, increasingly rare, as I'll talk about in the presentation as well. First off, yes, doctors think the internet is useful. No big surprise there. But you might think the bit on the right is a little bit interesting. We don't think that curricula necessarily reflect what is happening in real life. Now, anybody who has been subject to a pile of guidelines about this big that regularly come out from NHS bodies and CCGs and anybody who has an interest will know is that this is all static information, and it's actually really irrelevant when you are trying to find things for the patient in front of you. So for the patient in front of you, what you want is access to the right information at the right time, and that is what the internet provides you with. So all the people who spend a lot of time and effort doing guideline reviews and getting all of this all right for everybody, what they fail to realise is that actually the clinicians at the front line want information that is relevant to their patients. And interestingly enough, you do change your practice as a result of the internet, which again shouldn't be a great surprise. I'm sure that everybody in this room has learnt something on the internet that has impacted on their daily life. If they haven't, they're a bit odd. But I won't go into that. Anyway, age determines which social platform you're using and also what you want out of it. So my daughters would not touch Facebook with a barge pole because that's where their dad is. Strange that. So Instagram, WhatsApp, all the other apps that they use are different to the ones that we use as parents. And we all use things differently. So people talk about Twitter. Twitter to me is a place where people shout at each other. Okay? Facebook is somewhere that people share what they've had for dinner. Actually, different people use different things on Facebook, on Twitter, on social networks. So what are they using that particular social network for? Because often it is unexpected. So do the physicians in France use Facebook? In fact, French doctors don't use Facebook very much, if you look at the analytics that we've done. So different countries will use different platforms. Different age groups will use different platforms. Therefore, where are your doctors and what are they using it for? It comes back to the point I think was made in the search talk about actually understanding your market, where they are, what they're doing, because that is really important. I did say that I was going to talk about Hunt. This is what doctors are currently talking about. In actual fact, I think that's the old slide. Anyway, sorry, this was the old slide from March. What we'll do is I'll talk about what they're talking about now. They're obviously talking about the strike. You'd be very unsurprised to think, well, why wouldn't they be? So what they're doing is they're saying, what's happening in the strike? Where's it not happening? What are the consultants doing? What are the junior doctors doing? There's pizza, apparently, in one of the doctors' messes for the consultants, because Tuesday was pizza day for the doctor's mess, and normally the junior doctors share out their pizza, but in actual fact the junior doctors bought pizza for the consultants who were doing their shifts. So it's all about collaboration between the consultants and the juniors, because the vast majority of consultants actually support their junior staff. You know, we've done surveys, and you'll find that 90 to 95% of the consultants are fully behind their junior doctors. This is not a fight of junior doctors. This is a fight of the whole profession. So, you know, the GPs are squarely behind the juniors, and they're all in there making supportive comments. You will occasionally get the odd person who disagrees. And of course, that makes people angry. But that's what social media is. People have a right to be angry. Okay? The problem is if that then spills out into the press and the implications of that. So we'd have to be very careful. One of the other things they're talking about at the moment is about the announcement that the GP contract is going to be renegotiated and we're going to be given a whole load of money. And we don't believe it. Okay? We are very cynical We think this money will come with huge strings and huge promises which will not be delivered. So Jeremy Hunt promised 5,000 new GPs. In fact, we learned today that 700 GPs have left the profession in the last year. So he's now got 5,700 to get in the next 5 years. So this is the sort of thing that we're talking about, is actually, here is what the population's being told, and we know on the ground that's a load of rubbish. And trying to then get that and mobilize that out into social media, saying, you know, this is the article, why don't you tweet that? Why don't you shout about that on this platform? So we will then use the other platforms mobilized within a professional network as well. So it's cross-linking between Facebook, between Twitter, possibly between Instagram, but I'm not allowed on that one, and various other places that you get. So don't think of them in isolation. Think about what people are using them for. I did promise you a bit of discussion about Hunt. People have been reminded how, as a sports minister, he was the person who was responsible for security at the Olympic Games, and that went very well. He was also culture secretary and was in charge of reining in the Murdoch Empire. That went really well. And he's a homeopath who's written a book on how to destroy the NHS. I mean, privatise the NHS. I think he's on plan for that one. But anyway, so essentially we are talking about these things, but we're doing it in a safe, secure environment. So why is this important, and why is that relevant clinically? Well, whilst they're on there, we can also do other things. So we heard about Zika virus, and we heard about the fact that social media platforms were very useful in actually highlighting the Zika virus. Now, we had a consultant from emergency medicine who went out and actually helped out in the Ebola outbreak. And so when he was out in Sierra Leone, he was actually blogging about what he was doing in Sierra Leone. So we had a man on the ground who was basically talking about what was happening, and people were commenting, and he was then posting back as a result of that. So it's an interactive environment, and this was of interest. It was probably one of the most popular blogs very rapidly because it was of actual relevant interest. You can see he was tweeting, I mean not tweeting, but he was putting pictures of where he was and what the problems were. And this, often what you'll get from news releases is not what's actually happening on the ground. So we've also been working with the RCGP in putting forward clinical cases that are tricky. They're not easy, there isn't a right or wrong answer. Because the one thing you learn after coming out of medical school is you've learned a whole load of stuff, but in actual fact it isn't relevant for the job that you end up doing. There isn't a right or a wrong answer on lots of these. You need to discuss it with colleagues. You need to discuss it with others. And how are you going to do that? So what we have is, because we have that social media environment, people will discuss this. And this is also being mirrored onto the RCGP side. So it is a discussion within DoctorsNet UK, but it is also a discussion that's being had on the RCGP website. So the technology platforms can actually have that conversation going on in two places and combine those two discussions into one. So that's one of the advantages of the technology that we're now using. So this was a campaign that we ran for cancer research around skin cancer. So you can see there's various different elements to this. So you've got the lesion recognition resource, and you probably don't want to go in there too much. It's pretty grim. You've also got image discussion. And so people can post images of various things that they've got, and people can then discuss what it is that they think that might be and give suggestions. So it's about actually having the platform where people can interact and can actually then help each other out when it isn't clear. You can see that we've also got accredited education. This was, again, in conjunction with the RCGP and with British Association of Dermatology. So what we have is we have a quiz. and we look at what people know. So we'll put a picture of a lesion up, and they'll go, well, what do you think it is? And you'll have that. And people can then see how they score against their peers. So it isn't a case of you've got this right or you got this wrong. It's a case of, actually, 90% of you got this right. That's great. If you're in part of the 10%, you think, ooh, maybe I need to gem up on that. But that is only visible to you as a user. We obviously get the data at a bigger level, but the individual user gets 90% of your colleagues got this right, 80% of your colleagues got this right. Actually, don't worry too much because none of you got it right. In which case, we then have a problem. Now, what this then does is it allows us to link various different campaigns that we've got. So you have the Royal Marsden who do offline events, and you've got Cancer Research doing online learning. And one of the things that you think is, hang on a minute, can we do something with that? And yes, we can. Because what you do is essentially you take an expert who thinks they know everything about everything, because they tend to, and they say, well, we think that people don't know X about this condition. Sometimes they're right, but they can be wrong as well. So it might surprise you to know that actually when we did a survey, a quiz around renal disease and diabetes, the GPs got it right more times than diabetic specialists. Okay, so GPs have greater knowledge about the renal impact of diabetes compared to the diabetologist. That's probably because the diabetologists go, they've now got renal disease, over to him. And so the GPs have to have more general knowledge. But it was a bit of a surprise. Okay? So one of the things you need to do is, if the expert says the GPs or X body don't know about this, test it. So what you do is you use a quiz, and you use that, and you use big data, and you can profile people, you know where they live. So we know that this is a GP and this person is 45, and get all that profile data, and then you match it with what they know and what they don't know. So you merge data sets. And then what you do is you give it back to the expert, and you said that they didn't know this. They do actually know that. So we're not going to talk to them about that, because that's teaching them to suck eggs. So when you go and talk at the Marsden, what you do is you actually give a talk on the bits that they don't know, rather than the bits that they know already, because that makes far more effective education. Because if I sit here and tell you what you already know, you're going to be out that door, like that person. Oh, no, sorry. Quicker than you can do it. Now, online is actually probably one of the most brutal markets, because if you don't get it right, guess what? They walk out that door without you even knowing about it. Okay? If you don't retain them online, there is very little to stop people walking out the door. If you wanted to walk now, you'd actually have to walk past all these people and everybody would see you. Online, nobody sees you walk out. And you've got to remember that. So what you do is you then video the offline. And what you do is you feed it back into the audience and then get their comments. So that what you're continually doing is actually working out what your audience knows, what they don't know, what their opinions are, what the barriers are. And I say barriers to things are often either around knowledge, attitude, or they're because the NHS doesn't allow you to do it. Okay? Now, if you're coming up against a barrier, have you worked out what that barrier is? Because I bet you there are loads of fantastic campaigns out there to improve knowledge that already exists. But they haven't actually worked out that the reason why the doctors aren't behaving in the way that they think they are is because they haven't worked out the attitude. Or they haven't worked out the NHS won't allow them to do that. So you're banging your head against a brick wall. So obviously, pharma people being in the room, I've just presented a whole load of NHS and Cancer Research. So you can use it. Okay, social media, it can be used within a professional network. The problem is it does need to be a bit more controlled because people don't like adverse drug reactions being talked about for strange reasons. I can't imagine why. So what you can do is you can collate a set of questions that you think doctors don't know. So you ask your expert first off and they say, well, I don't think they know this, so we'll put these first questions up. But then what you do is you get people to submit their own questions and you answer those questions. And what you do is you use the tools that are there in a trusted environment to actually answer the questions that people have. And of course, they may go onto this site thinking, oh, I'm going to ask this question. But when they're there, they actually go, oh, I didn't actually know about that. Remember, nobody's looking over their shoulder, so they'll then click on that. So I'm going to make it short and sweet. The doctors are probably not using open networks for patient-based discussions. And those that do are probably on the outside of the profession. I do have a slide with Christian Jensen on it, okay? He is not very well respected within the medical profession, shall we say. I can tell you from our forums.
Explain who he is.
He's Mr. Plastic on embarrassing bodies. Oh, sorry, that's his name on our forums. So he's known as Mr. Plastic, okay? And he has no respect amongst the medical profession, okay? Now, he might be fantastic for patient groups because certain patient groups might think he's, great. But in actual fact, for the doctor audience, he is the wrong person, by far the wrong person. And he also gives advice that is frankly dangerous on Twitter, okay? So he is a big advocate on Twitter and he does all this wonderful stuff, aren't I fantastic, but gives wrong advice, okay? So those sort of doctors are not the normal ones, okay? The ones that are giving patient advice, because the vast majority of us are extremely conservative and there is absolutely no way that I'd ever get into a conversation with a patient on Twitter. And I am very digitally keen, but there is no way that I would do that. Okay? They will use the network socially or professionally. Okay? So they might go to a conference and you'll see a whole load of hashtags from a conference. But that is all that they do. So you'll find lots of doctors' accounts which are hashtagged to the conference, and that's all, because that's what they're using it for. Okay? And then they might use Facebook for something else. So different doctors are using different things, but most will not use open networks for patient cases and discussions. Okay? Very, very dangerous for doctors. GMC loves doctors who've done that. Not. And remember, they're not the only forms of social media. And it will change. The environment is constantly changing. And back to the fact that it's listening. Lots of people want to shout about what they're doing, okay? But this is, what we do is we listen to what's happening. And then what you can do is you can mold and you can do different things as a result. You're not using the social media to shout about your product. You're in social media to understand and liaise with the people that you're working with. So that's really all I would say, which is don't shout at me. Okay, I've had lots of shouting marketing in my time from pharma, and it's interesting being on the other side, going and doing a bit of shouting at you, but I would plead and beg, in actual fact, don't shout at me, listen to me. And that's the end.